Hello, everybody. My name is Karen DePicco, and today I am interviewing Dr. Orlandis Wells, the author of Doc, Please Listen, and the owner of Henderson OBGYN, which is the fastest growing practice in Henderson, Nevada. We are so honored to have Dr. Wells today. Dr. Wells, welcome to the show.
Well, Mr. Pitco, thank you for having me on the show. I really appreciate the opportunity to come talk about my life's passion.
And your life's passion is what?
Making women whole.
Oh,
Helping them
wow.
restore that life. Get back to that fun, vibrant, just being the best woman that they can be, that I know they can be. I want to help them get back there.
Oh, that's so amazing. Well, one of the questions, not the questions that we have, which we have a ton of them that we're going to get to, but one of the chapters in the book is about Lisa, and I was really just taken aback by Lisa. She says, I have been having migraines for months. So I went in finally, but it wasn't exactly the fix I had been hoping for. The doctor was less than sympathetic. I'm prescribing Tylenol, the doctor said. The next week, I could feel the beginning of a migraine. I immediately reached for the bottle of Tylenol. Not only did it not stop the migraine, it didn't seem to have any effect. Later, I made an appointment to see Dr. Wells. So when Lisa's story, part of it, what I love about your book too, is that you really do give in-depth parts of the story so that we can see exactly what's going on inside some of your patients' lives. And I think what happened was she was having some perimenopausal symptoms. And so can you tell me about what typical perimenopausal symptoms are?
Yes, Karen. May I call you Karen? I'm a Southern gentleman, and I would not want to disrespect you by calling you by your first name. I will call you Mr. Pitco, but if Karen works best, will you please allow me to call you Karen?
Absolutely. Please call me Karen.
Okay, Karen. So your question was, what is perimenopausal symptoms?
Yeah.
Well, perimenopause is that state in a woman's life. It could be anywhere from 10 to 15 years before actual menopause. Most women know what menopause is, but until recently have we as a gynecological community recognized perimenopause as a legitimate disease entity. What perimenopause is, it's an area where it's a premenopausal state, like I stated, that it can produce a variety of hormonal imbalances and fluctuations, caused by imbalance in hormones. With some of the symptoms, there's a ton of symptoms. Some of them irregular periods, heavy bleeding, hair loss, insomnia with sleep disruption, dry eyes, vaginal changes, especially vaginal dryness, with some hot flashes and weight gains. That's just some of the symptoms that are associated with perimenopause.
Wow. Well, I noticed that in the book, the story that Lisa was having is that she was having these horrible, horrible migraines. And so, how does perimenopause really cause the migraines?
Well, it's because during this stage, when a woman reaches 35 years and over, the ovaries, I like to give the analogy of being in an old saloon with a big beer keg stacked up with full of eggs. And during a woman's reproductive years, all the eggs on top, we can see they're good, they're full. But what's going on with the eggs at the bottom of the barrel? Are they cracked? Are they split open? Have they lost the yolk? So when they get over 35, they're kind of scraping the bottom of the barrel, literally. So that the egg quality is not good. So therefore, if the egg quality in the ovaries aren't any good, then therefore you're going to get some hormonal changes. And that's when perimenopause get those fluctuations where the periods become irregular. Even if she's having a period every month, doesn't mean that she's having an ovulation period, which causes the hormonal imbalance. And that's where the headaches and everything come from, the hormone imbalance. It's all a balance in that, Karen.